Type 2 diabetes is a fat storage problem inside of your liver and your pancreas. For decades, even doctors were taught to believe that type 2 diabetes was irreversible, that it was a slow but progressive condition caused by sugar and genetics. But what if I told you that type 2 diabetes is actually a reversible metabolic condition? And science now has proof of this. Hi, my name is Bella, and you're welcome to Bella Zen Health, where we discuss all things about metabolic health syndrome and we teach ourselves how to better manage it naturally. For so many years, mainstream medicine treated type 2 diabetes like a one-way street, and a diagnosis meant the beginning of a lifelong dependence on medications like metformin, later insulin, and eventually a life of complications from vision loss to kidney failure, foot ulcers, and even amputation. And if you still believe that today, it is okay, because that is what doctors, nurses, and healthcare professionals were taught to, that the pancreas wears out, that insulin resistance just gets worse, that it is manageable but never curable. But all of that changed starting around 2008. Stay with me for the next 10 minutes as I walk you through a timeline of one of the most life-changing medical discoveries in modern health. This new discovery into how type 2 diabetes can be reversible all started with patients undergoing bariatric surgery, the kind of surgery where they reduce the size of the stomach. Something strange started happening. Many people with type 2 diabetes saw their blood sugar levels normalize within just a few days after surgery. And this was way before they lost any significant weight. These results confused researchers. How was diabetes reversing even without losing fat yet? Clearly, something deeper was happening inside the body, and that was something more than just weight loss. In 2011, Professor Roy Taylor and his team at the Newcastle University designed a breakthrough study to test a radical idea. What if diabetes wasn't caused by sugar, but by fat trapped inside vital organs? So they decided to put people with type 2 diabetes on a low-calorie diet of 800 calories per day, using simple shakes and non-starchy vegetables for just 8 weeks. The results were groundbreaking. Fat inside the liver decreased dramatically. Fat inside the pancreas also reduced. The pancreas started to produce insulin again, and the participants' blood sugar levels normalized without any medications. And this was the moment where everything changed. From this research, Professor Taylor introduced the twin cycle hypothesis, a simple explanation for the root cause of type 2 diabetes. Imagine two cycles happening at the same time inside your body, feeding each other like gears in a machine. When we eat more food than our body needs, fat tends to build up in the liver. The liver then becomes resistant to insulin, and it keeps producing too much sugar into the blood. When the liver stores are full and there is still excess of that fat and the body needs somewhere to store it into, that excess fat in the liver spills into the pancreas. This fat clogs and stresses the pancreas. The beta cells in the pancreas that are responsible for creating or making insulin become damaged, drive the development of type 2 diabetes. But here is the best part. You can break the cycle. If you reduce the fat inside of these organs, your insulin works again and your diabetes can go into remission. In 2012, this discovery earned Roy Taylor the Banting Lecture Award, the highest scientific honor given by Diabetes UK. Since then, a direct trial led by Dr. Taylor and Professor Mike Lean has confirmed that this approach works, not just in labs, but in the real world. Over 45% of participants in this study reversed their type 2 diabetes within a year. Remission was maintained for up to 2 years and beyond. Global bodies like Diabetes UK, NHS England, The Lancet, and the American Diabetes Association now acknowledge that type 2 diabetes can be reversed in many cases, especially if caught early. This is no longer a theory. This is real and it is happening. If you've been told you will have type 2 diabetes for life, I want you to know that your body has the power to heal. Type 2 diabetes is a fat storage problem inside of your liver and your pancreas. And with proper lifestyle changes, especially through calorie reduction, intermittent fasting, eating real whole foods, and with guided support, thousands of people have seen their type 2 diabetes go into remission. This is not alternative medicine. This is evidence-based, doctor-led, peer-reviewed science, and it is changing lives every day. So now you know the truth. Type 2 diabetes is not a life sentence. It is a reversible metabolic condition. If this message gave you hope, and if you've learned something new from this video today, please do not keep this video to yourself. Kindly share this video with someone you love, whom you know is struggling with type 2 diabetes. Drop a comment below if you've got any questions or if you think that type 2 diabetes can be reversed. Let me know your thoughts in the comments. I'll see you in the next video where I share how I did help and support my dad to reverse his type 2 diabetes naturally without the need of any medications. If you're interested to know how we did that, subscribe to my YouTube channel so you will get a notification as soon as I publish the video. Thank you for watching, and until next time, bye-bye.